Hello everyone and welcome. This is number 5 in a series of 12 webinars curated by Selectpath to help organizations and their decision makers to stay on the right path journey. My name is Jeanette Novak. I'm a Right Path advisor, and I'll be taking you through today's presentation on digital health. This presentation will be recorded and sent out to all registered attendees. A hyperlink will be provided on the client resource page on our website. We ask that everyone mute their mic until the end of the presentation, and please feel free to use the chat feature that will be monitored throughout the presentation. Alternatively, you can jot down your questions to ask after the formal presentation has ended. Selectpath will record questions and answers to be made available along with the presentation afterwards. The subject in today's presentation is intended to be a guide, and as such, we recommend seeking legal guidance before making any changes that have legal implications. The opinions expressed in this presentation are that of the presenter and do not necessarily present the opinions of the organization or your own advisor. If you find today's presentation informative, we recommend sharing it with anyone you believe would benefit from receiving it. So let's get started. COVID-19 has accelerated the growth and adoption of digital health technologies. The World Health Organization Global Strategy for Digital Health acknowledges the potential for technology to accelerate human progress, predicting these solutions will help ensure more people enjoy better health and well-being. Specifically noting applications that enable virtual care, remote patient monitoring, and data exchange across the healthcare ecosystem, the strategy suggests these technologies can improve experiences within the care continuum and drive enhanced health outcomes. Simply defined, digital healthcare is the electronic collection and compilation of health data, decision support tools and analytics with the use of audio, video, and other technologies, and the delivery of preventative, diagnostic, and treatment services that promote patient and population health. Access to digital practitioners, services, and resources is easier than ever. Whether you're looking for government-funded programs or if you have access to resources through an employee benefits program. Of course, virtual care is not possible for every service. For example, a dental hygienist can't clean your teeth remotely, but many others have been able to adapt. So practitioners like psychologists, physiotherapists, naturopaths, dietitians, social workers, OTs, speech therapists, audiologists. A quick Google search will bring up a multitude of online health and wellness resources. And if you have access to Workplace Employee Assistance Program, or if you enrolled in a health and wellness incentive program, there are endless libraries of excellent information on a wide range of topics to pore through. And now we have access to some really helpful cost-saving, time-saving, and potentially life-saving services through online pharmacies and programs like Vitality, and most recently, Vaccine Hunters. This is helping thousands of Canadians find vaccines, which in turn is helping to avoid wastage at clinic and pharmacy levels. The need for rapid adoption of digital health technology has been driven by the unprecedented impact of the COVID-19 pandemic. In March 2020, provinces and territories expanded coverage of virtual care. The goal was to make it easier for healthcare providers to offer assessments and care remotely. In Ontario and other places, this includes mental health treatments. We've got good reason to use virtual healthcare whenever possible now to help stop the spread of COVID-19. The great news is doctors and other healthcare providers have gotten better at using virtual platforms to provide care. Many now believe virtual care will be an important part of the healthcare in the future. Powered by new technology, virtual care will move healthcare towards a more preventative and patient-centered system. According to Canada Health InfoWay, 40% of all primary care visits are now virtual. 90% of Canadians were satisfied with the virtual care that they received. 86% said they saved valuable time, and 81% said they saved money. So using virtual healthcare means, most importantly, less travel time to and from appointments, less time off work, and consequently less need for childcare. Of the Canadians that used virtual healthcare in the last year, 76% said they avoided at least one in-person visit to a doctor. 83% said they were satisfied with the virtual care that they received, and 72% said the virtual care helped in a moment of crisis or distress. The options for virtual and digital healthcare is growing rapidly, and as such, current providers are expanding what they and how they offer their services. The government has taken action and is now funding certain aspects of virtual care. And so let's take a look at the largest players in this growing market. We have EQ Care and Akira from TELUS Health, MindBeacon, Dialogue, Lumino, Maple, Tia Health, and Cloudmd. We'll then take a peek at online pharmacies and the health and wellness incentive programs. So TELUS Health has broadened its offerings, bringing together two massive leaders in Canadian virtual care, Akira by TELUS Health and EQ Care. This partnership provides Canadian employees with 24/7 immediate care. Powered by leading technology, EQ Care cost is around $50 per person per year. Employees can access EQ Care via mobile, tablet, or computer 24/7 in English and in French. Enrollment takes a few minutes. Patients will be asked to answer a few short questions about how they're feeling, and a member of the care team will be standing by to assist. This care team consists of nurses and care managers who help patients to navigate the healthcare system and ensure that they're matched with the right healthcare practitioner. EQ Care has both physicians and nurse practitioners available that have extensive experience in general medicine, mental health, pediatric health, dermatology, and a number of other specialties. These practitioners can assist with specialist referrals. So EQ Care can refer you to a local healthcare facility for blood tests or other follow-up examinations. And the referrals are received immediately, and care managers will arrange the earliest possible appointment. You can get prescriptions, which are sent directly to your preferred pharmacy, or you can even have the medications delivered directly to your home. You can get sick notes. As well, EQ Care's team of healthcare professionals and its proprietary support tools are designed to proactively help employees address both physical and mental health challenges before they manifest into chronic and complex medical issues. These issues obviously negatively impact performance and productivity. Confidentiality is paramount, and the aim is really to empower the employees to take the initiative and prevent avoidable conditions from turning into longer-term health issues. Virtual mental health care will play a very important role in the societal recovery from the impact of COVID-19 for years to come, as will the types of therapy available to patients. Cognitive behavioral therapy, or CBT, is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, eating disorders, and even severe mental illness. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective or more effective than other forms of psychological therapy or psychiatric medications. Virtual cognitive behavioral therapy, or VCBT, are now conducted through secure video, voice, and text-based platform. This enables licensed mental health professionals to quickly establish a therapeutic bond with a patient in the comfort and the privacy of their own home or any other personal and private space. The results are proven to be as good or better than an in-person clinic visit. As an alternative to virtual CBT programs, EQ Care offers a digital CBT program that is structured to enable employees to progress at their own pace through a series of programmed self-help therapy modules with online support by an EQ licensed mental health practitioner. It's a convenient and confidential evidence-based tool that has been clinically proven to improve mental health and well-being of patients. For employees on disability, EQ Care offers a virtual medical service to conduct independent medical evaluations, or VIMEs, and medical mental health fit to work assessments. Disability management services often require the assistance of an independent medical examination to clarify a mental health diagnosis, which essentially puts the individual on track for effective evidence-based treatment, and also to assess whether a current treatment plan is optimal. The virtual independent medical evaluation occurs through EQ Care's secure online platform, which eliminates wait times and travel costs associated with an in-person examination. Disability case managers can connect the employee with a psychologist or a psychiatrist from the privacy and the comfort of their own home. So next we move on to MindBeacon, which also offers a therapist-guided program, which is based on cognitive behavioral therapy. So this is described as therapy on your terms. MindBeacon's therapist-guided program is ideal for those struggling with issues such as anxiety, stress, and depression. And it's now free for all Ontario residents. Thanks to funding by the Government of Ontario, no payment of any kind is required as long as you have a valid Ontario health card. Users of MindBeacon eliminate the worry of keeping appointments. The program is available whenever and wherever is most convenient to you. And users can access MindBeacon on any web-enabled device they prefer. A therapist creates a personalized plan, and through secure direct messages, readings, and activities, and therapists will help users to develop the skills they need to thrive. Users of the program work one-on-one with a dedicated therapist for up to 12 weeks, and then they can access the resources that they've been using for up to 1 year. So once again, this program is free for all Ontarians who are 16 years and older. Dialogue describes their offerings as humanized healthcare, essentially an employee wellness program with hundreds of medical professionals supporting millions of Canadians at more than 250 organizations. From an employee standpoint, Dialogue offers a 360-degree approach that ensures patients get the care and the health outcomes they want and need, with personalized follow-ups after every consultation. Employees using Dialogue can expect 5 times faster diagnosis, which really allows for more patient-practitioner talk time. They can also expect concierge-level navigation support for all referrals to in-person specialists. Dialogue offers peace of mind to employers with a white glove, bilingual onboarding, which makes implementation effective and results easier to achieve. Dialogue offers insights and anonymized reporting that gives business leaders an understanding of usage and health trends at an aggregate level, as well as offering tailored engagement campaigns and ongoing education that drive member usage and positive health outcomes. Dialogue also boasts SOC2 compliance, meeting strict bank-level criteria for security and privacy. Pricing for Dialogue starts at $7.95 per employee per month for businesses with up to 100 employees. For larger businesses, the pricing is flexible. Lumino Health Virtual Care in partnership with Dialogue and offered by Sun Life. Through Lumino Health Virtual Care, plan members gain immediate virtual access to qualified healthcare professionals. They can access it through an app or online through a computer. They can do this at home, at work, or anywhere else in Canada. When they request a visit, they are triaged through an artificial intelligence-based system. The system then places the employee into a video chat with either a nurse practitioner, or a doctor. Virtual health professionals can diagnose any condition that doesn't require a physical exam, which includes about 70% of primary care cases. They can also help plan members book specialist appointments, including mental health practitioners, as well as scheduling standard follow-up visits. As with the other virtual healthcare providers, the mechanics are very much the same with Maple. Patients can access Maple as an individual or through a private healthcare plan or health spending account. It's important to know what can be accessed through a virtual healthcare provider and what cannot. And these apply to most virtual healthcare platforms. So you can access medical advice, you can get prescriptions, medical notes, and lab work requisitions. You cannot use the virtual healthcare platforms for medical emergencies, controlled medications, and in the case of Maple, disability and school forms and backdated sick notes. So Maple offers 3 options for using the service: a pay per visit, membership, or credit package. The pay per visit costs $49 per weekday visit, $79 per weekend and holidays visit, and $99 for an overnight visit, all per person. Membership options are $30 a month for a personal membership and $50 a month for a family membership. Credit packages offer discounts when you pay upfront. For example, $100 credit costs $95. And if you're accessing Maple via an employee benefits plan, further discounts are also applied. With Tia Health, you can access an online walk-in clinic fast and free with a valid health card in Ontario, British Columbia, and Alberta. Skip the waiting room and connect with an online walk-in doctor at a time that suits you via computer, tablet, or a mobile device. Access convenient and hassle-free online walk-in appointments with a Canadian doctor of your choice. Tia Health has doctors that speak multiple languages and with multiple specialties. Tia Health provides the same services as the previous platforms, as well as resources to get connected with a long-term physician in your area. And as if we could ever forget our furry friends, yep, Tia Health even has veterinarians available for consultations. Cloudmd is currently only available in BC and Ontario. They serve the patients currently without a family doctor or those who seek medical care after hours. The service is designed for prescription renewals and diagnosing non-emergency conditions. They have a national network of doctors that are Canadian licensed, and all of the doctors are qualified to practice family medicine in their relevant province and are registered with the College of Family Physicians of Canada. The goal of Cloudmd is to provide more patients with an affordable, convenient way to access the care that they need. Patients will need to be connected to the internet, and where possible, it's recommended to use Wi-Fi as data charges may apply. Cloudmd operates Monday to Friday, 9 to 7, and Saturday and Sunday, 9 to 5. So now let's take a brief look at some of the supplemental services offered within the digital world of healthcare, beginning with online pharmacies. Alliance Pharmacy, Pocket Pills, PharmX Direct are just a few of the online pharmacy options. Using an online pharmacy is simple and easy to use, with easy registration and integration with doctors and medical practitioners. The good news is that there is no cost to use these online pharmacies, no cost for delivery of medication, and the cost of medication is actually less because traditional pharmacy options have overheads and online simply doesn't. So here's how it works. Create a profile on your preferred online pharmacy portal, enter your current pharmacy and physician information, and enjoy free home or office delivery. The packages received are discreet. Medications can be organized into a pill pack option and sorted by date and the time to take the medication, and automatic refills take the worry out of missing a dose. You have the option to talk to a pharmacist if you are starting a new medication, as you would in a traditional pharmacy. And it's a great way to manage medication for those who are unable to do it themselves. Two major players in the health and wellness incentive programs are Green Shield's Change for Life and Manulife's Vitality program. Both programs offer online health assessments and the ability to track your activity through wearable technology such as Fitbit, Garmin, and Apple Watch. These programs offer incentives and rewards for maintaining a healthy lifestyle, rewarding members for things like routine screenings and tests, as well as taking online health and wellness courses. Manulife has integrated Vitality into individual life insurance, incentivizing policyholders to reduce their annual premiums, and more recently joined the group benefits space, offering a similar program to plan members. They aim to establish a health and wellness culture in individuals as well as organizations. Recently partnering with Good Life Fitness to offer virtual group fitness classes, they continue to build on and expand the Vitality space and its offerings. I think we can definitely expect more and more programs to emerge in the coming years as virtual health and wellness continues to evolve. So this concludes our presentation today, and I thank you so much for spending your time with me this morning. I hope that the presentation provided you with some useful information, and do feel free to share it. Once again, it will be available along with the others in this series on our website at www.selectpath.ca/resources. Stay connected with us here at Selectpath either by phone, email, or like us on Facebook, catch one of our tweets, or follow us on LinkedIn. We're always happy to connect. Thanks again for joining me, and have a great rest of your day.